Good afternoon, and thank you for being here today. I want to start off today by thanking you and everyone else who attended and tuned in to the bicentennial inaugural last week. I'm glad we all were able to share in such a historic day for our state. Earlier today, I had the opportunity to give the keynote address at the graduation ceremony for the Missouri State Highway Patrol's 110th recruit class. It's not easy being a law enforcement officer, especially in today's time. I greatly appreciate these individuals who have answered the call to serve. On the COVID-19 front, we continue to see encouraging signs in the data. The data shows that cases are declining and vaccine availability is increasing. Missouri's current positivity rate is 12.4, down from a high of 24.4% in November. In the past week alone, our positivity rate has fallen nearly 5 full percentage points. And unlike other states, Missouri did not see a dramatic increase in cases over the holidays or the weeks following. This proves that Missourians are continuing to do their part by taking a balanced approach and practicing preventive measures. Each and every day, Missourians are still stepping up to do what is necessary to protect themselves, their loved ones, and I want to thank them for that. We are thankful that we're starting to see a decline in cases, but the volume of COVID-19 hospitalizations remain high. Although we are seeing signs of hospitalization declining, our healthcare system still remains strained. Currently, 288 healthcare professionals have been contracted to provide support to the Missouri hospitals through our partnership with Vizient. But even as we provide support to our hospitals and work to decrease hospitalization, we must continue to take precautions. This, combined with the vaccine, is how we will protect ourselves, our neighbors, and our healthcare workers. On the vaccine front, supply remains extremely limited. But every day, we are in a better place than we were before. We continue to receive steady shipments of vaccine each week. By the end of this week, we expect to receive more than 76,000 initial doses and another 76,000 initial doses by the end of next week. To date, over 265,000 total doses have been administered throughout the state. Everything continues according to our vaccination plan established in October. Although some updates have been needed to adhere with changing federal guidance and new information we've gathered from stakeholders across the state, the fundamentals of our plan have not changed. It is important for all Missourians to understand that until vaccines become more widely available, they will be administered on a very limited basis. Again, we encourage all Missourians to visit mostopscovid.com to see the latest updates and to find out when they are eligible for the vaccine. Missouri is in a strong position, which allowed us to announce the activation of Phase 1B, Tier 1, and Tier 2 of our vaccine plan last week. The activation of tiers allows more Missourians to start signing up for a vaccine sooner. But again, it is important to remember that current demand far outweighs the current supply. The reality is that even though your phase may be activated, does not necessarily mean you will be able to receive the vaccine right away. We must all be patient and understand that the state and our partners are working as quickly as possible to get vaccines into the arms of every Missourian who wants one. We will be activating the National Guard to help speed up the vaccination process. Today, we are announcing a partnership between the National Guard, the Department of Health and Senior Services, and other state partners to establish mass vaccination sites across the state. There will be a mass vaccination team assigned to each of Missouri's 9 Highway Patrol regions. Each team will have the capability to administer as many as 2,500 doses per day. The National Guard has already begun the process of securing these sites and will start administering vaccines by the end of the month. We will be starting in southeast Missouri. We will have a setup this weekend to make sure we run all the traps, to make sure everything's going well as we expand into the weeks to come. For more information regarding dates and locations will be released once they are finalized. In addition to these mass vaccination teams, we will also be sending targeted vaccination teams to Kansas City and St. Louis to work with the clergies to assist in the most vulnerable populations. The purpose of all these vaccine teams is to support our existing vaccinators and provide additional vaccination sources for eligible Missourians that may otherwise have a hard time receiving one. On top of the vaccination teams, the National Guard will also be deploying administration teams to assist with data backlogs at the local levels. We are still getting a lot of questions about the number of vaccines received compared to the number of vaccines administered. I want to point out that a big part of the difference is due to the delay in reporting. Currently, there are at least 68 vaccinators that are manually reporting data, which slows the process and creates a backlog of paperwork. This backlog causes the total number of vaccines administered to appear much smaller than it actually is. In reality, there are many more vaccines that have been administered but not yet been reported to us. The National Guard administrative teams will help vaccinators get caught up on reporting, which will bridge the gap in the numbers and provided a better reflection of how many Missourians have been vaccinated. Today, Major General Compton and Dr. Williams are both here to provide more details. So first, let me turn it over to Major General Compton.
Hey, thank you, Governor, and good afternoon. I'm glad to be with you today to provide an update on how your Missouri National Guard continues to work alongside our interagency partners to identify areas where our assistance may be needed across the state. In support of the whole of government response to the COVID-19 pandemic, the Missouri National Guard remains activated and currently has 290 service members on missions supporting COVID-19 response efforts statewide. These service members are providing assistance at regional food banks, supporting data entry and call center operations, and assisting the governor's vaccine distribution planning group. In addition to these efforts, the Missouri National Guard is beginning the process of assisting the Department of Health and Senior Services with the operation of vaccination sites across the state. The Department of Health and Senior Services is the lead agency for this effort and works in coordination with regional implementation teams and our Missouri National Guard to provide both mass vaccination sites as well as targeted vaccination sites that Governor Parson just briefed on. I'll explain a little more on both of these teams. Our airmen and soldiers will provide 30 personnel per mass vaccination team to assist with traffic control, administrative support, and data input, ensuring local civilian medical personnel can rapidly distribute vaccines, and all reporting information is up to date. Mass vaccination sites are planned for each of the 9 Highway Patrol regions, and more details concerning locations and dates will be released as they are finalized. In order to provide vaccinations to populations outside reach of the mass vaccination sites, the Missouri National Guard is assisting DHSS by providing targeted vaccination teams with 4 personnel per team. In addition to our support to mass vaccination and targeted vaccination teams, the Missouri National Guard is providing support teams to our interagency partners to assist providers with completing paperwork that accompanies the vaccination process. This will help Missouri providers update records so they are more able to focus on administering the vaccines. These support teams will consist of 3 personnel each and have the ability to travel as needed. We're so very proud to be a small part of this whole of government effort to provide COVID-19 vaccine to our fellow Missourians. This effort is truly a team effort led by DHSS and obviously consisting of many partners, including physicians, hospitals, pharmacies, clinics, county health officials, local governments, and others. We're absolutely honored to be in support of our state and local officials as they complete incredibly important work for all Missouri citizens. Hey, as always, supporting the citizens of the great state of Missouri has been and continues to be our top priority as we maneuver through this pandemic. And as always, we stand ready to assist Governor Parson and our teammates as needed. Governor Parson, I appreciate your continued trust in the Missouri National Guard, and thank you for the opportunity to serve the citizens of our great state and country. It's one team. Good job.
Let me just say this as we kind of finish this up, and then I know Dr. Williams is going to come out, so we'll give him a chance to speak, and then we'll just go into questions right there, Kelly. But as you can see, Missouri has a plan, and these vaccination sites will provide additional help in administering vaccines as quickly as our supply will allow. I want to thank the Missouri National Guard for once again answering the call to help Missourians in a time of need. Since the start of COVID-19, the National Guard has assisted with food distribution, staffing test sites, constructing an alternative care site, and much more. And I have no doubt that they will get the job done again. This group of dedicated men and women has fulfilled each and every one of our requests without hesitation or delay. We owe a debt of gratitude to our Missouri National Guard members for their service, especially for their efforts these last 10 months. I also want to thank General Compton. When he took that position over, we didn't know that was going to happen either in a short period of time, and for better terms, he had to go right in the frying pan on multiple fronts. I want to thank him for his service and couldn't be more proud of him as the Adjutant General of the Missouri National Guard. With activation of Phase 1B tiers and construction of mass vaccination sites, more Missourians will be able to begin receiving vaccines. But I will say this again. Timelines remain fluid and dependent on vaccine supply. Taking preventive measures is still the #1 way we can protect ourselves, including washing your hands, practicing social distance, wearing your mask, and avoiding large or unnecessary gatherings. This combined with the vaccine is how we will win the COVID-19 battle. We have faced many challenges over the past year, but I assure you that there is light at the end of the tunnel. By working together and doing our part, we will continue to overcome these challenges and continue moving Missouri forward. Thank you, and God bless. Dr. Williams.
Thank you, Governor. I want to start out just by thanking the people of Missouri. When I got up this morning and looked, as I do every morning, we were 9th in the country for cases per 100,000 over the last 7 days to the good. That's been a trend that's been going on for about 3 to 4 weeks now. And that is a testament, again, to the people of Missouri taking those measures. I started the day at a 7 o'clock phone call with a doctor from another state and said, "What are y'all doing? How are you doing that?" Which made me pause. We realize it's dynamic. We never take anything for granted. But I reflected on that, and I truly think, that we have had from day one an all-hands-on-deck approach. The governor has said that we're going to use every resource you need. We're going to give you every resource you need to do everything we can. And so, again, when I look around the country, California, Texas, some other states, certainly realize that every state is different. But at this moment in time in Missouri, it would just be inappropriate for me not to thank everybody for where we are. Now, having said that, we have not identified a case of the UK variant yet in Missouri. It is in the Midwest. It's in Illinois. It's been in Indiana. Certainly seeing that around the country, so we're watching that very vigilantly. We get tests back, and so far we've been blessed that they've come back negative, but that could certainly be a factor we're watching very carefully. We are taking every advantage of this opportunity to get out the vaccine. We're in a little bit of a race, and so we are doing everything we can to distribute the vaccine as quick as we get it. Let me emphasize for you, the rate-limiting step in Missouri for getting a vaccine is how much vaccine we get. I want to thank you who took the time on Thursday. I know this is kind of complicated, but you've done a great job of trying to process this of the way it works. But I'm just going to reiterate for some of those of you who aren't here and for our general audience that we never get the vaccine physically at the state. We don't have a big warehouse where there's 100,000 doses of vaccine. What we do as part of our federal partnership is we distribute it where it goes. And in the beginning, when it was just 1A and it was mostly large hospitals and the smaller hospitals, that was fairly straightforward. Ship 10,000 doses to a hospital, they vaccinate everybody in their hospital. Ship 150,000 doses to the federal government, they vaccinate all 1,300 long-term care facilities. Pretty straightforward. Now we've opened it up because the governor has said that as soon as we could, we were going to get to our most vulnerable, people over 65, people with comorbidities, 2.5 million people in Missouri. So we've now opened up that universe, but we are only getting about 80,000 vaccines a week. So you can see 2.5 million, 80,000 have gotten through the hospitals to a certain degree, healthcare workers, and our long-term care facilities. So now we have all our vaccine, the 80,000 doses, to concentrate on this large universe. So what we do every week, we find out through a system called Tiberius how much we're getting. For this week, it's about 80,000, as the governor said. And then we look around the state, and we equitably distribute it based on multi different factors. Geography, we know where people have gotten vaccine, so we go where they haven't. We go to areas that we know are potentially more vulnerable. Saturday, I'll be giving vaccines in an area of the state that we know we have particular vulnerabilities. So I'm going to join. We've had 750 med students volunteer to give vaccines. I can't thank them enough for that. So I'll be working with some doctors, and I'm a board-certified physician, so I'll be giving vaccines as well. So that is how we decide it, and we do that every week. We look at who's gotten it, who hadn't gotten it, and try to spread it around. But I want to reiterate the governor's message, is that we are incredibly appreciative that we're getting so much affirmation. I was at Cole County Health Department yesterday, and they are doing a remarkable job. They put me to shame. I was in private practice 30 years, and their rolling out the vaccine is just spot on. It couldn't be any better. But we realize that if you have 80,000 vaccines a week and 2.5 million who are eligible, that's going to take time. And I know you're already doing the math and saying, well, Dr. Williams, that will take so long. But we think that AstraZeneca and the J&J will be on board in March. So don't do that math quite yet. We think it's going to get better for that. People asked me today's transition. We've been in contact with the Biden administration. They've contacted us again today. They've asked for some information. They are putting out plans, and so we'll very much interact with them. So again, thank you for what you're doing to help communicate. Highly commend to you our website. It's nationally acclaimed, mostopscovid.com. And with that, if you want me to answer questions, Kelly, I will, or come back.
We'll open up some questions, Jack.
Okay. Hey, Jack.
Hey, Dr. Williams. I was just looking at the CDC website before I came in, and it said that they've distributed 572,000 doses to the state. I know that you've said that there's a lag time in reporting, and that might be why it says that there's only 244 doses administered. So do you have an estimate on how many doses have actually been administered?
Yeah, thank you, Jack. And that number always strikes every reporter I talk to. And they go, wait a minute, I'm seeing 544,000, and I'm seeing 270 or 250 today administered. Where are the other 250,000? So let me answer that, and I appreciate the question. The first thing is the governor very rightfully insisted that we ship our Moderna immediately to our long-term care facilities because that's where 40% of our mortality was coming from. So, Jack, just to give you an example, we've given them about 140,000. When I looked at this morning, it was only reporting 26,000 of those had been vaccinated. And so I think there are more than that have been vaccinated or are being vaccinated, but that's a universe right there of about 120,000 that we don't control the reporting of. That's through CVS and Walgreens. So and they have told us they're going to be finished on January 25th. Today's the 21st. So we know that we've shipped about 130, 150,000 vaccines to them that they're finishing on the 25th. So they're either doing it as we speak and haven't reported what they've done. So that'd be the first aliquot that I would tell you about.
So they haven't reported any of the 150,000?
26,000 this morning is what they've reported. And we gave them about 150,000. Okay? So that's the first thing. All 1,300 long-term care facilities in Missouri signed up to get vaccinated. So that's the obvious right there that you can kind of go, wait a minute, sent out 150, you've only had 26,000. That's 110 right there. Then the other part of it, Jack, is that there is just a natural lag time in when it's shipped to us and when it actually gets vaccination in arm and gets reported to us. So we give people 10 days. We say, look, you've got 10 days. But what we do know is this, is we know every day where every vaccine in Missouri is by location. In other words, if we sent you 1,000 to every location, we know if you say you've administered 500, then that means where are the other 500? So we watch it closely. To the governor's point that we were just on a phone call with the Missouri Hospital Association, we watch it very closely. Okay, you got 1,000. You've told us you've administered 500. The clock's ticking on the other 500 because we control the allocation. So we are convinced that in Missouri there is no hoarding or no stockpiling or no inefficiency in getting the vaccines in, to the best of our knowledge.
Do you have an estimate on how many shots have actually been administered?
250,000. Actually, shots in arms is the number I saw this morning.
So there could be more shots that have been administered?
Oh, absolutely. I'm sure there are. I'm sure.
How many more?
That they have to report it. So, I mean, we're dependent on them reporting to us. So my hunch is that they're using that 10-day window and they just haven't reported it yet.
So 250 you know for sure. I'm just trying to clarify.
Yeah.
No, it's not clear. Maybe we'll 250,000 administered and there's more that you don't know.
250,000 that we know have been administered. We know where the other vaccine is, and we track it to make sure that it is going to come in. And if you look at the numbers for the last 4 days, we've had a doubling of vaccinations. So that's encouraging to us. Thanks, Jack.
Hi, Dr. Williams. You mentioned that you had some conversations with the Biden administration.
Yes,
can you go into a little bit more detail about what you've discussed and what you hope to discuss in the future?
Yeah, a couple weeks ago, they sent out a memorandum that I answered just asking what issues we were seeing with vaccine distribution. They wanted to go over our plan. And then just today, I got a long email that I've skimmed, but I haven't read it completely, just about their overall plan. And then right before I walked over here, I got another email wanting, it was a query to ask us about vaccination distribution again. So I'll do that tonight. I'll get that information back to them. So those three contacts we've had.
Sebastian?
Is Major General Compton coming out as well?
After Dr. Williams.
Okay, awesome. So I know that in Boone County, for example, our health department has said they're still working on Phase 1B Tier 1 and they're waiting on Tier 2. Do you have at the state level an idea of where the different regions are at in terms of their distribution? Because I've heard from health officials in rural Missouri that they're still waiting on vaccines for 1A, and so they don't know when they're going to get further along.
Thank you for the question. Yeah, I know exactly. I have a map where we see where every vaccine is, and I can look at it, and I've got a map over here of areas that are vulnerable, and so I can say, wait a minute, this is where vaccine's been, this is where we're vulnerable, and I don't see any vaccine there, so they're going to get the next allocation. So that's the first thing. The other thing we've done that I can't thank our team enough, DHSS and a lot of others, is we've redistributed 100 different allocations of vaccine. You know, the Pfizer comes in 975. And so what has happened is that we'll have it go to Poplar Bluff or Cape Girardeau or Joplin, and they don't need all of it. So we quickly redistribute it to get it to those rural areas. And it's harder, but the governor's made it very clear that just because it's harder doesn't mean you don't do it. So right now, 100 times we've taken an allocation of 975 that might have gone to Joplin and taken 500 of it and moved it over to Neosho. Now, that gets problematic because when the second vaccine comes in, the government makes us send it to the first place, and then we got to get it again to the second place. But that's okay. As the governor said, just because it's hard doesn't mean we don't do it. So we're doing that. And one other question I want to intuitively, once we've opened up the population, 1A, 1B, Tier 1, Tier 2, everybody's eligible. So if two people are sitting in the waiting room and one's 1A and one's 1B Tier 1, they're both equally eligible. And everybody, all of the state has to stay on the same operating rhythm. You're not allowed to kind of move beyond. So our goal is to be equitable and fair. And to do that, everybody needs to be moving at the same rate.
We'll take one more question.
Okay.
This might be for the governor, I'm not sure. You talk about supply and everything really hinging on supply, and that obviously is going to take time. So in the meantime, with the economy hanging in the balance, what is the plan to get that going while we're kind of in limbo as we depend on the supply?
I am going to let the governor take that.
I'll come up there and ask a question.
Well, Major,
Yeah.
let's go with the dad first.
Hey, thank you.
All right, Sebastian.
Hey, Major General. A question on the support teams that you mentioned that are going to be assisting with vaccination record data entry. I know the state has more than 1,200 approved vaccinators. Do you know how many of the support teams the National Guard's going to be able to provide?
Yeah, as I mentioned earlier, the support teams themselves will have one team per region across the state. There's 9 regions, so a total of 9 support teams. Thank you for the question.
And this might be for the governor, but is there a logistical reason the Guard wasn't used in this way before? Why not sooner? And what can the Guard do that we weren't currently doing?
Yeah, I'll take a cut at it, and if the governor wants to, obviously he'll cut on it too. But I think as we're trying to demonstrate today, vaccine is the limiter, and as vaccine rolls in, we're going to be in position and place to assist and expand the local health agency's capacity. So we're really excited about being able to do that, so vaccines get provided. And as the governor mentioned, and I think I alluded to as well, is we're going to be able to provide support to the local officials with updating that paperwork to track vaccines that have been administered.
Are you saying that the Guard wasn't used before because you didn't have the quantity to distribute that you do now, or you hope to have soon? I'm just trying to figure out why the Guard wasn't involved from day one.
Yeah, it's a great question. And I think you're right. We're at a place in time right now where we, the Guard, can come on and really support and expand local health capacity as it's needed.
All right, thank you.
All right, thanks.
Governor Parson?
Good job, General. Let me clarify for the General there just real briefly. When you asked the question, why didn't we use the Guard before, we knew exactly what the targeted audience was that we were going after, and we knew that number was around 500,000. We knew that was all within the healthcare system who was going to get that. They were well capable of being able to handle that. But when you expand to what we did on the 65 years old, now you get into the millions. And then your isolated spots all across the state, you get into very rural areas versus urban areas. And it's just a matter of logistics of trying to get the support out there for the healthcare system alone. And that's why we've activated the Guard at this time. And I do think, I know Dr. Williams talked about, the data is really important to get that in. But here's the one thing I think I want to ensure all Missourians and what Dr. Williams was saying. You know, I'm not so much worried about getting all the paperwork in. I mean, I want to get it in. That's why we're activating the Guard. But it's much more of a priority to get that vaccine in somebody's arm. So if that paperwork's a week late and the reporting numbers don't quite jive, that's okay. As long as I'm confident and as long as we're doing our job to get that vaccine in people's arms, that's what's important.
Hey, Governor, there were hearings for a number of bills in the state Senate today, the gist of which is to take authority to make public health orders away from public health officials and put it in the hands of county commissioners. Is that something that you support, or are you staying with giving that authority to public health officials? Yeah,
you'll probably get this standard answered for the whole session. Until I see what that legislation looks like, to comment on legislation early in the session I don't think is probably good for me or good for the legislators, whoever's handling this, because I think it's pretty misleading until we get a finalized bill. Look, we know there was instances within the healthcare system that probably people didn't do as good a job as they should have on the local levels. There's no question about that. But I think what the legislators do with that and what comes out of that, we'll just have to see. But look, I think we all went through a pandemic that none of us had ever seen before. To go back and reevaluate all aspects of how we handle it is a good thing. So I think anytime we're looking at the way we actually administered everything and the way this all rolled out, it's a good thing to see if we can do it better. I would think everybody would want that.
Hi, Governor. Now that the phases are moving forward with the distribution plan, have you received the vaccine yet?
I have not received the vaccine. I do qualify, I will tell you that, if you're just wanting to know where I'm at in the age bracket, I guess. I do qualify for that. The reality of it is me and the First Lady have both been exposed to the COVID-19. I feel like right now, I will take the vaccine. Let me just say that. I will take it. I just think right now there's a lot more people out there in that range and that are priorities more than me. Now, I get the idea of being governor and how important that is. But I think I've also talked to Dr. Williams. I know what the medical staff says, where I've had it before, and what the risks are. And I think within a month or two, I think you're going to see more and more vaccine coming available. And I think it'll be a more appropriate time for me and the First Lady at that point. But I will assure you I will take the vaccine. It's just a matter of timing for me.
Hi, Governor. You mentioned this briefly, but with the new Biden administration, they're pushing for a large number in the first 100 days. What's Missouri's role, and how are you helping to get that goal, or what's Missouri's role in this?
Yeah, well, I think we're preparing for that every day. I think that's why the National Guard's activated. I think just like going out, first of all, and doing a mass vaccine to make sure, hey, let's get all the kinks out of the system, is preparing for that day when more and more vaccine comes in. And I think the more we can do on the front end of that, the more we'll be prepared. Because at some point there will be a huge amount of vaccine and a huge amount of people in the millions that are going to be requiring a vaccine. So we want to prepare for that. I hope everything they're saying is correct. I hope the quicker we get the vaccine out and we get it in people's arms, I think it's better for the ones that want it. I think that's a priority. So all this we're doing right now with the Guard and everything, we're preparing for that day. We'll be ready. Missouri will be ready when that day comes.
And then is there any, with Missouri lawmakers in session right now, is there any legislation that can help this, or do you know of anything that's they're working on around the vaccine?
You know, not that I know of in a legislative session, because even so, it would take several months for anything to go in effect without emergency clause and a lot of things that they have to go through. I think right now the plan we submitted to CDC in October that we're executing is where it is. And I want to address this. I get everybody wanting to jump up on the line and saying, hey, our job's important and it's more important than somebody else's job, or I need it worse than somebody else. I totally understand all that. But you have to have a plan in place. We're going to have to execute that, and everybody's just going to have to wait that time to come up. We're going to get to everybody. We'll get to everybody.
We have time for a couple more, Governor.
Okay.
Governor, if I may be so bold, I'm not sure what the protocol is here, but I'd like to ask a question that strays from the COVID topic that we've been discussing. We're discussing Missouri issues, but it is a huge day in the nation today. Is there anything you would like to say to the new president and vice president, a message to them?
I haven't even thought about that. I mean, you know, today's been, you know, and I want to be respectful about this when you ask me that question, because I know how politically that could be made real quick. Every day I'm in this office worrying about Missourians. I'm working about a vaccination plan. I'm worried about a state of the state coming up when people ask me, how am I going to fix the economy? You know, the great news is you're going to know that in just a few more days, so what we're going to put in place like that. You know, the powers to be changed in Washington, D.C., and that's part of the process of our democracy. I don't know that that's a surprise what's happened up there as far as the inaugural goes today. It's inauguration day up there, but for us in Missouri, it's a work day. Like most other states, you go to work and you do your job.
Yeah, to follow up on the last two questions, what kind of relationship do you anticipate having with the Biden administration, even just generally, but especially on COVID? And in your view, is he the legitimately elected president of the U.S.?
Well, first of all, again, I'm not going to get the political hype of all this. He's the president. He took the oath of office today. That's what I do know. Let me just wrap this up so we don't get everybody tries to figure out what's the governor saying. But let me be real clear on this. When I was in the United States Army, you served the commander-in-chief. The commander-in-chief is the president of the United States. He doesn't go by Democrat, doesn't go by Republican. He is the commander-in-chief of the armed forces. Over the years, I want every president, no matter who they are, no matter what the circumstances, I want the president of the United States to do well. Because if he does well, the country does well. That's what's important for me, that they put the country before themselves. So as far as my administration goes, from day one, we put Missourians first. Whatever I can do to work with an administration to put Missouri first here in the state, I will do. And I've always done that. So, you know, time's going to tell what we're going to go through on the state level. But, you know, the one thing I will tell you with the COVID-19, the vaccine, you know, I don't care who ships out the vaccine, just ship it out. Get it to Missouri. If you can get it to me in Missouri, I can take care of it from there. And that'll be my main focus. All right, thanks, everybody.